this is a fairly straightforward YAG procedure, but the quality is phenomenal. Just watching that posterior capsule separate and come apart.
And you can see already, these are not in focus because I tried to be a little bit behind. So my offset behind, meaning it's the treatment is actually 100 microns behind the focus point. I still try to be a little bit further in. My settings in this particular laser, every laser is different, so you need to adjust to make sure it works for this one, but I try to keep them low. I do a cross pattern first. As you can see, I try to make sure everything's separated so that these flaps can actually fall back. And if they don't fall back, I go one more time in the middle to make sure that they open up completely. And as we go down, you will see that everything opens up very nicely. And if it doesn't, again, I go back just a little bit. But each treatment opens up quite a lot of space. So it's not like they have to be immediately adjacent. You can see how much treatment is done by one shot, if you will, and how much else needs to be done after that.
Now, that point you made about the focus, just explain that to me. So I'm looking and I see two dots of light right there. Mm-hmm. So and if they were in focus overlapping, you would be on the actual lens material?
Well, you can put the focus on the capsule. The capsule is actually the part that, because it's opaque, is easiest to focus on. But the two will tell you where the light is focused, meaning where they meet, that's the focal point of the laser. And then there's a dial that offsets it by either 0, meaning it's exactly the laser shoots at the same part as your focal point, or it's plus 100, plus 250 behind that focal point.
Got it. And if you were to be focused just a little more anterior to that, then you would run the risk of a lens pitting, depending on the type of lens material, possibly.
Correct.
I feel like I see a lot of bubbles bursting out, but I can't imagine they're truly bubbles, or are they exactly what I think they are?
With the YAG laser creates small bubbles of plasma, that is that high energy, and it's a little cavitation bubble. So if we shoot that laser at air, you'll literally see a little flash.
Okay, got it.
That I think in one of our videos we will have.
Yeah, we actually have another very interesting YAG case here. So this, I want to set the stage. This is a patient who was experiencing dysphotopsia. It's a type of sensation where they notice an aberration in their vision, whether that be a dark shadow or perhaps even almost what looks like a white reflection or a crescent shape of light. So she was seeking treatment for that.
There's two kinds of dysphotopsias. One's positive, meaning adds. One's negative, meaning subtracts. Negative would be a shadow, can actually be seen in a visual field as well, as long as it's far enough out. And the current theory, which seems to correlate best with treatment and symptoms, is that the overlap of the capsule over the lens creates shadows in places that weren't there before, that then creates a negative dysphotopsia. Here the treatment is to remove that edge along this line so that the patient does not suffer negative dysphotopsia anymore. And the patients that are really bothered by this tend to be very vocal about it as well. As you can see, this is now completely free. That edge is not covered anymore. I'm trying to loosen up this little piece so that it can be not attached to the lens or interact with it anymore.
So is it fair to say that that white area, as long as it's touching the edge of the lens, intraocular lens, it's going to be blocking light and causing, in this case, the negative dysphotopsia?
It's almost basically anterior, yes. That's again. With this one, the patient was very happy afterwards. She said that had gone away, and she'd been bothered by this for years. And most of the time, it goes away by itself. But the patients who are bothered by it either notice it and say, "I'm fine dealing with it," but the ones that are really bothered by it, it drives them crazy. Other treatments are either very broad rim glasses, moving the lens, or adding a lens into the sulcus, meaning in front of the lens.
If those options fail, I assume this patient would need a lens exchange, a new lens?
For negative dysphotopsia, lens exchange is not as helpful. Positive dysphotopsia, as in the glimmering that you see, change in lens material can be the treatment of choice and can be very helpful.
Nice. Now, this was a very interesting YAG. This didn't look like any typical posterior capsular opacification that I had seen. It looks like a lot of random white spots just all over the surface, but not really a continuous sheet from what I can see.
Yes, and I'm still not 100% sure what it was. It clearly was opacity. It clearly was on the capsule, and the patient had much better vision after this. Treated it the same as any YAG capsulotomy, but this is not something that I would have expected. It almost looks like asteroid hyalosis, but just on the capsule.
I thought that too, asteroid hyalosis. Was the energy required the same as any traditional YAG as well?
I didn't treat the spots, I treated the capsule, and the capsule just responded exactly the same as a regular capsule would to laser.
Nice. That was a fun one to watch. I just like seeing it explode out and all those little white spots go away. So great result for that one. And then last example here, this is a very short video, but this is a patient with, I want you to actually introduce this one.
So the envelope, the capsule, is supposed to shrink wrap around the new lens. And at the end of surgery, we use viscoelastic during surgery that is a substance that maintains space during surgery. And all of that viscoelastic should be gone at the end of surgery. We place the viscoelastic around the lens. And sometimes that viscoelastic can get trapped behind the lens and create, because it's hypertonic, can attract more fluid and create a quote-unquote capsular block syndrome.
This would have similar symptoms to what we might expect from a PCO. When I look at the lens in these patients, and I don't think that we see this very commonly, but when we do, it almost looks like a turbid type of fluid behind the lens and in front of the posterior capsule. This fluid that's just trapped in that space.
It's usually a flat anterior and a curved posterior, and sometimes you just overlook it because it looks like a mildly opacified lens, which we're used to, but it shouldn't be there. There should be just a clear lens, posterior capsule, and an anterior hyaloid.
And you can see when we slow down that video to a quarter speed, just that fluid rushing back through and escaping out of where it's been trapped.
Exactly, because the pressure in the bag is higher than the vitreous, so as soon as it's punctured, it comes out. It almost looks like a vacuum of space, except in this case, the pressure is higher. Actually, the same thing. Pressure is higher on this side of the opening and then lower on the other side, so everything gets pushed out into the vitreous.